everyone, and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting speech pathologist and myofunctional therapist Samantha Weaver. Today we'll be talking about facial pain and sleep. Welcome back to the show, Samantha.
Thank you.
So, how is facial and head and neck pain related?
When a patient comes to us as a myofunctional therapist, they're generally not in a state of acute pain. Because if they were, they would have seen a specialist who is looking at the mechanics of the jaw joint. And they would most likely have gotten that treatment because of the severe acute pain. But what we see, and what I believe is maybe 80% of facial pain, is muscle related. And the muscles are influencing how the bones are supported. So you have to imagine, let's say somebody has a tongue tie that was not diagnosed, and they come into the office at age 49, they're getting orthodontics for the third time, and part of the treatment plan has been to help treat the teeth and get them into better occlusion, but also aesthetically they want a better appearance because they're grinding. So what's causing the grinding? So we always have to think about what's causing the pain. So in the case of bruxism, which is so common, we know that airway and breathing influences how the brain is giving a signal to awaken the body with oxygen desaturation. So treating the muscle pain that comes out of grinding is really looking at function. How do we get this person to breathe through their nose? How do we get their tongue to go up in the palate so that all these other muscles are not under stress? And the tongue is really the flying buttress of the cathedral for the jaw, because the tongue supports the jaw. And when the mouth is open and the tongue doesn't do its job, all these other muscles are being recruited, and that contributes to this low-grade facial pain that a lot of our patients have. And they say, well, I take Advil for it, or I get headaches. But we're always trying to understand, is this muscle-based? Is it influenced by breathing and tongue function?
So to touch a little bit more on breathing, what is that correlation between facial pain, head and neck pain with sleep apnea or sleep breathing disorder?
So it's kind of a chicken and egg scenario, because let's say the baby is tongue-tied and then they establish an open mouth breathing posture. And for their whole life, and essentially what's happening is that the face is growing vertically and the angle of the jaw is coming down. Well, that is really going to have an impact on the mechanics of the joint. And so what you have to see is that it's all interconnected based on how bones grow. So if there's a vertical growth taking place, you can absolutely bet that the airway is being impacted, and the facial pain that occurs maybe mechanically because of the jaw joints. Then there's this kind of what caused what scenario. And so many of these cases are untreated for what we call posterior tongue tie. And it has such a huge impact on facial growth and development, but also how other muscles basically compensate. And that includes the neck muscles, the occipital region, the base of the skull, recurring headaches that are caused by cranial strains. And essentially, one of the things that we talk about is sleep posture. How are you sleeping? Are you on your side, your stomach, or your back? Well, a lot of these cases, people are stomach sleepers or they're side sleepers. And that puts so much pressure on the joint, on the shape of the face. It impacts how the face grows. It creates asymmetry, but the strains that you see are also related to sleep posture as well.
And myofunctional therapy, how does that play into this? How can myofunctional therapy help facial pain, head and neck pain, and also sleep breathing?
Well, again, it's the muscle pain that we're addressing, or the muscle discomfort. One thing happens that I think is so fascinating. When somebody breathes through their mouth, they have reduced sensory input of the oral cavity. So interestingly, it's called stereognosis. The ability to detect the shapes inside the mouth reduces with oral breathing. And what that means is that people are in a less sensitized place, so they don't really understand proprioception. They don't understand if their tongue is up or down because they're not really getting all of the sensory input based on oral breathing alone. So one of the things we work on is basic awareness. How are you during the day and night? Are you sleeping on your side or your stomach? We definitely have to look at habits and cognitive behavioral techniques to mitigate stress response. So clenching is a stress reducer, it turns out. If during the day, and you have to think of people who are behind masks, stress and how you process stress, clenching could be a servo system for the body, but it could also create pain patterns. So we look at the habits. We try to get people aware of when they're doing things in their daytime activities. And then we look at nighttime habits. Are they breathing through their nose? Are they breathing through their mouth? Do they get up in the night to take a drink of water? These are all signs of oxygen desaturation, especially restless sleep. So we're looking at daytime habits, nighttime habits, and then we're setting up a structure of accountability to do exercises that address muscle function, but over time, they are gaining a new functional habit in terms of sleep and breathing, and that's going to improve all of these other systems connected to breathing.
So what are some of the specific treatment options that you recommend for head, neck, facial pain, and sleep breathing disorders?
Well, of course, as a myofunctional therapist, I'm always looking at muscle, and then I'm looking at the function. So restoring and improving breathing is the key to everything. And if somebody is in a state of sympathetic overdrive, they're not getting enough deep sleep, then you really have to think about how can I serve this system so it can restore itself at night. And of course, a CPAP, mandibular advancement device, these are proven techniques and appliances that can actually change how a body functions and even how a body responds to stress and pain. So when you have people who are in pain and they have reduced sleep efficiency, it's really a snowball effect. People are overwhelmed, they drop out of work, their function in life degrades very quickly. So if we can improve breathing, whether it's through CPAP, through a mandibular advancement device, and then establish how to restore and maintain nasal breathing with the tongue up in the airway at night, then you can really help the system calm down and then integrate all this new education that comes with myofunctional therapy.
Great. Thank you so much for coming on to the show today.
Thank you.
The sleep professionals in this video series teamed up with Whole U to spread healthy sleep education across America and were paid for their appearances.